This is Pooja and I'll be talking about Mr. Vin Nguyen case study. The purpose of this presentation is to interpret theoretical knowledge into practice, to understand type 2 diabetes mellitus and learn the impact of this condition on Mr. Nguyen. Use of 8-step of clinical reasoning cycle to manage his condition and eliminate any risk or further complication. Use of Roger-Logan journey model of nursing to identify issues for daily living activities. Consider Mr. Nguyen's situation and link the type 2 diabetes mellitus, its pathophysiology and clinical manifestation, process the information relevant and identify any relevant activities of living which might be affected because of his condition and nursing issue for the patient. To establish goal and take action, evaluate, reflect, and I'll be concluding the presentation and the references. The concept map of Mr. Vin Nguyen. He is 48 years old and he lives with his mother-in-law and son. His wife died of cancer, father had passed away because of acute myocardial infarction, and mother had lung cancer and is remission, who is living in Vietnam, so he's from Vietnamese background, who is currently residing in inner West Sydney and works as a full-time civil construction laborer. Past medical history includes gout, asthma and hypothyroidism, and he is currently on these medication to manage his disease condition. So he is awaiting for a sleep study for obstructive sleep apnea, and he has 3 packs of cigarette per week, 2 beers per day, and he has takeaway food 6 times a week. He felt lightheaded and dizziness and fatigue and had a fall in the morning. So when he presented to the hospital, his vitals are in normal ranges, but he is tachycardic and his heart rate is 106 beats per minute. Upon the urine dipstick, it shows glucose in the urine but no ketone bodies. His cholesterol is 9.2 mmol per liter and BGL is 23.5 mmol per liter. His height, weight circumference leads to a high BMI index, body mass index, that is 35.2. His hands and feet are cool and dry with dry mucosa, and he has been diagnosed with type 2 diabetes mellitus, and his hyperglycemia is getting managed with metformin. 2 diabetes mellitus is a chronic condition in which glucose is not uptake from the blood to cell, leading to hyperglycemia. There are many risk factors of type 2 diabetes mellitus, such as increasing weight, increasing age, hereditary, diet, lifestyle, and obesity. To relate with the history of Mr. Nguyen case, it reveals that he has an unhealthy eating habit as he depends mostly on the takeaway meals, which is significantly high calorie food. His BMI results obesity, and these are the 2 predisposing factors for hyperglycemia. Pathophysiology of type 2 diabetes mellitus is that the beta cell of pancreas releases insulin when the body has high amount of glucose. The insulin receptor in the cell reacts to the insulin, then the glucose is taken from the blood to cell, but due to predisposing factors, the cell becomes insulin resistant and does not take up any glucose from the blood to cell. When the cell does not get any glucose, liver also breaks down glycogen into glucose and it creates hyperglycemia. The clinical manifestation of Mr. Nguyen is polyuria, polydipsia, fatigue, episode of falling, and tachycardia. Frequency and the volume of the urination increase due to osmotic diuresis. The glucose is a solute and it attracts water during filtration of urine, and reabsorption of water is also decreased due to the presence of glucose. Polyuria leads to loss of water and electrolyte, which subsequently leads to dehydration and electrolyte imbalance. This results dry mucosa, fatigue, increased tiredness, loss of consciousness, Another impact of electrolyte imbalance is rapid, irregular heartbeat, and it is manifested in Mr. Nguyen. Dehydration stimulates hypothalamus to increase thirst or polydipsia in Mr. Nguyen has increased his beer intake from 2 to more. Mr. Nguyen has high cholesterol level because of his unhealthy dietary habit, so he is in risk of developing cardiovascular diseases, and his hyperglycemia, if it's uncontrolled, then he might get into this acute complication called hyperosmolar hyperglycemic non-ketonic state, which is a very life-threatening condition. He has sign of dehydration and polyuria, so he might get into hypovolemic shock if it's unmanaged. It is important to identify these issues because if it's unmanaged, then this will lead to long-term irreversible complications such as nephropathy, retinopathy, or neuropathy. So the nursing diagnosis to identify risk and issues are hyperglycemia related to obesity and unhealthy diet as evidenced by the PGL of 23.5 mmol per liter, electrolyte imbalance related to dehydration and polyuria as evidenced by the tiredness of fall episode and tachycardia, deficient knowledge related to unfamiliarity with type 2 diabetes mellitus as evidenced by the continuity of unhealthy diet and alcoholism. So the potential impact of his condition to activities of living is on eating and drinking. He cannot be take away food daily. He has to be in diabetic diet, and the drinking habit has to be stopped to manage his diabetes. For the work and playing, he's a single father, and the family depends upon his income, so he might have some financial restraint, and as he works in construction, he might get some minor injury or cut which could lead to tissue necrosis. His sleep has a disrupted pattern because of polyuria, irregular sleep pattern as he's waiting for obstructive sleep apnea study, and he works overnight, so his body might just not get enough rest and sleep. For the SMART goals, for hyperglycemia, we can decrease his BGL into normal parameter with some of the medication like the metformin and regular screening of BGL. Electrolyte imbalance could be managed by intravenous therapy or electrolyte replacement therapy, then monitor in fluid balance chart. If he does not know anything about diabetes mellitus, then the health education on diabetic diet, exercise, sleep, rest, medication follow-up, and the routine BGL monitor could be given to Mr. Nguyen. Prevention and rationale of hyperglycemia is to monitor BGL regularly, as its rationale is to record any fluctuation of BGL. Prescription of metformin helps to control hyperglycemia, whereas referral to dietitian helps to plan out sustainable diabetic diet. For the risk of electrolyte imbalance, electrolyte replacement therapy could help out or balance out the electrolyte in the body, which prevents from all the clinical manifestation which was shown by Mr. Nguyen, that is fatigue, tiredness, and tachycardia. And deficient health education helps to follow sustainable lifestyle, so if he does not know anything about type 2 diabetes mellitus, then the health education would be really beneficial for him. In order to evaluate the goals, the blood glucose level has to be maintained, and electrolyte in the body needs to be balanced, and Mr. Nguyen must follow a very healthy routine in order to achieve our goals. Mr. Nguyen has type 2 diabetes mellitus, which is insulin resistant, and in order to manage his type 2 diabetes mellitus, pharmacological lifestyle changes and diet control needs to be maintained. One improvement is early detection of the symptoms in order to prevent any other further complication. This presentation has improved my knowledge regarding type 2 diabetes mellitus, pathophysiology, identifying nursing issues and diagnosis, pharmacological and non-pharmacological intervention with the rational and outcomes by using CRC. Thank you, and these are the references.